My name is Dr. Luke Webb. I'm one of the physician owners here at Asthma and Allergy Associates and Research Center. So eosinophilic esophagitis, also known as EOE, is a condition of the swallowing tube that leads to the stomach, where that swallowing tube gets inflamed because of the presence of eosinophils. Eosinophils are white blood cells that often get recruited to sites where there's inflammation, be it allergic or non-allergic, and they can cause a lot of damage sitting in those organs, and in particular in this case, the esophagus. The esophagus will get chronically inflamed and can get constricted, and people can get food stuck in their esophagus. They'll get full earlier. It'll take them a long time to eat because they have to chew their food really, really well before they can swallow it each time to avoid food getting stuck. People can get a lot of vomiting, particularly in young kids. When young kids get EOE, they'll often present with just recurrent vomiting. So this disease really was only discovered in the mid-90s. It wasn't even on anyone's radar until they did more biopsies with endoscopy and did specific staining looking for the eosinophil. Now that we have identified it, now that patients find out what this is after they see their GI specialist, a lot of times they're referred to the allergist to identify, well, is there a food that may be underlying this inflammation of my esophagus? Could this be from something else? And in kids 10 and under, foods are by far most commonly the culprit. Allergy testing is often helpful, though not always, to identify what is that food culprit. And if we can take that food out of your diet, it should make those eosinophils go away and their symptoms essentially resolve. In teenagers or adults, it's a little bit more complicated. Yes, foods still commonly are a trigger. There does seem to be growing evidence that just our environmental allergic exposures, because we breathe these in or swallow them because they're in our saliva, etc., and the chronic exposures to these can drive the same inflammation in the esophagus as foods could. And so it's a little complicated in some patients to find out why exactly is this going on. And in other patients, you can test them for everything and still never get a definitive answer as far as, well, what's causing this. There are many different ways to treat this. Some of them work very well, such as food avoidance if you know what your food trigger is. Unfortunately, some patients may have multiple foods that can be driving this, and that begins to get a bit complicated because these are often very common foods such as milk and egg and soy and wheat. There are many, many foods that could potentially cause this though. So if you have multiple foods that are very common, it's really tough to adhere to that diet. And even just getting that food in your diet once or twice accidentally over the course of a month can re-recruit those eosinophils there, and they will stay there for weeks until you've been avoiding that food again. So patients can have a real relapsing course of their disease and still have a hard time telling, why does this keep coming back? You know, we had been using, and still do to some extent, swallowed topical steroids. None of those are FDA approved for therapy. They are somewhat helpful. Some seem to work better for others, and obviously different patients respond differently to various therapies. We also can use some acid reduction medications. Those can be pretty helpful. The problem is that in higher doses, which is what you have to use in many of these patients, they do tend to have a lot higher likelihood of side effects. And so that's certainly something we watch for if patients end up having to be on these therapies. There are also several therapies that are being evaluated with clinical trials that may work more specifically to make the eosinophils leave the esophagus because they're really just not supposed to be there. So we're very hopeful that some of these therapies will be helpful for patients who just have not had good success with food avoidance or identifying their triggers as it is, or who may not be responding to other therapies that they're on. This often occurs very early in life, and what we find is that if you don't control this well, patients will have a very, very long course of this. And in the cases where it is driven by food, even trying to reintroduce the food 10 years later or so can make the EOE come back. So it really depends on the food, and it's different in every case. And this is why we try to evaluate these patients very carefully in concert with their gastroenterologist. So it's very important that we have that close working relationship with their other doctors.